Good morning, Mrs. Shindy. I am Dr. Sharma. How can I help you today? Good morning, doctor. I recently got married and would like a reliable method to delay pregnancy for a few years. I've heard about contraceptive pills, but I'm not sure how they work. That's a very common question. Oral contraceptive pills are a safe and effective method of preventing pregnancy when taken correctly. They work by preventing the release of an egg from the ovaries and making pregnancy less likely to occur. Are they safe for long-term use? For most healthy women, they are safe when prescribed appropriately. Before starting, we assess factors such as smoking, blood pressure, and any history of blood clots to make sure they're suitable for you. You mentioned suppression of ovulation and thromboembolic risk. What do those terms mean? In simple words, suppression of ovulation means the pill prevents the release of an egg each month. Thromboembolic risk refers to a rare risk of blood clots, which is why we carefully check your medical history before prescribing the pill. If I take these pills, will they also protect me from sexually transmitted infections? No. Oral contraceptive pills prevent pregnancy, but they do not protect against sexually transmitted infections. Condoms are still important for protection against STDs. What happens if I forget to take a pill one day? If you miss a pill, take it as soon as you remember, even if that means taking 2 pills in one day. Then continue the rest of the pack as scheduled. It's also recommended to use a backup method, such as condoms, for the next 7 days. Do I need to take the pill at a specific time? Yes, try to take it at the same time every day. This improves effectiveness and makes it easier to remember. Let me see if I understood correctly. I should take 1 pill every day at the same time. The pill prevents pregnancy, but not STDs. And if I miss a pill, I should take it as soon as I remember and use backup protection for 7 days. Excellent, Mrs. Shindy. You've understood perfectly. Do you have any other questions? No, doctor. Thank you for explaining everything so clearly. You're welcome. Feel free to contact us if you have any concerns in the future.
Good morning, Mrs. Priya. I am Dr. Sharma. How are you feeling today? Good morning, doctor. I'm 3 months pregnant, and I've been having headaches and body aches. I'm worried about taking medicines because I don't want to harm my baby. I understand your concern, Priya. It's completely natural to be cautious during pregnancy. Some medicines are safe, while others should be avoided. That's why it's important to consult your doctor before taking any medication. Doctor, my mother told me to avoid all medicines during pregnancy. Is that true? Not exactly. Some medicines are safe and necessary. The goal is to use only those proven to be safe for both you and the baby. You mentioned teratogenicity and fetal development. What do those terms mean? Good question. Fetal development refers to the growth of your baby inside the womb. Teratogenicity means a medicine has the potential to cause harm to the developing baby. That's why we carefully select medications. What can I take for my headache? Paracetamol is generally considered safe when taken in the recommended dose. However, you should avoid taking any medicine without advice. Sometimes I buy medicines directly from the pharmacy without a prescription. Can I continue doing that? No, self-medication should be avoided. Even common medicines can affect the baby if taken unnecessarily or in the wrong dose. What about herbal medicines? They're natural, so they must be safe, right? Not always. Many herbal products have not been adequately tested. Natural does not automatically mean safe. Discuss them with your doctor first. My friend told me some antibiotics can affect the baby. Is that true? Yes. Certain antibiotics may not be suitable. That's why every medicine should be evaluated carefully before use. If another doctor prescribes me a medicine, what should I do? Always inform every healthcare professional that you're pregnant. This helps them choose the safest treatment for you and your baby. Let me make sure I've understood. I should avoid self-medication, only take medicines approved by my doctor, inform healthcare providers, and check herbal products. Excellent, Priya. You've understood perfectly. Do you have any other questions? No, doctor. Thank you for explaining everything clearly. You're welcome. Take care of yourself, and I wish you a healthy pregnancy. Good morning, Mrs. Asha. I am Dr. Sharma. How are you and your baby doing today? Good morning, doctor. We're doing well, but I'm nervous. This is my baby's first major vaccination visit, and I'm worried because she has to receive several vaccines today. I completely understand your concern. Many first-time parents feel the same way. These vaccines are very important because they protect your baby from several serious infections during early childhood. Doctor, you mentioned valent combinations and attenuated immune responses. What do those terms mean? That's a great question. In simple words, some vaccines protect against multiple diseases with a single injection. The vaccines safely train your baby's immune system to fight infections in the future. Which vaccines will my baby receive today? At the 6-week visit, your baby is scheduled to receive vaccines such as pentavalent 1, OPV1, rotavirus 1, FIPV1, and PCV1, according to the National Immunization Schedule. These help protect against diseases like polio, diphtheria, pertussis, hepatitis B, pneumonia, and other serious infections. That's a lot of vaccines. Is it safe to give so many on the same day? Yes, absolutely. These vaccines have been carefully studied and are routinely given together. Receiving them on schedule provides the best protection for your baby. What if my baby develops a fever after the injections? Mild fever or slight swelling can occur and are normal signs that the immune system is responding. If needed, you may give paracetamol in the dose recommended by your healthcare provider. My neighbor told me vaccines can make babies sick. Should I postpone them until she's older? No. Delaying vaccinations leaves your baby vulnerable. The benefits of timely vaccination greatly outweigh the temporary discomfort that may occur afterward. Is there anything important I should keep after today's visit? Yes. Please keep your baby's immunization card safe and bring it to every vaccination appointment. It helps us track which vaccines have been given and when the next doses are due. Let me make sure I've understood. My baby should receive all scheduled vaccines today. Mild fever is normal. I should keep the card safe, and I shouldn't delay future vaccinations. Excellent, Mrs. Asha. You've understood perfectly. Do you have any other questions? No, doctor. Thank you for explaining everything clearly. You're welcome. Your baby is getting important protection today. We'll see you again soon. Good morning, Mr. Rohit. I am Dr. Sharma. How are you feeling today? Good morning, doctor. I'm feeling better now, but the sudden breathlessness I had yesterday really scared me. The hospital said I have asthma and prescribed an inhaler. I've never used one before. I understand your concern, Rohit. Asthma is a condition where the airways in your lungs become narrow and inflamed, making it difficult to breathe. The good news is that it can be controlled very effectively with proper treatment. Will I have asthma forever? Asthma is usually a long-term condition, but many people live normal lives when they use their medications correctly and avoid triggers. You've prescribed a salbutamol inhaler. What does it do? Salbutamol quickly relaxes the muscles around your airways, helping them open up so you can breathe more easily during an asthma attack. Doctor, you mentioned bronchospasm and bronchodilation. What do those terms mean? That's a great question. Bronchospasm means the muscles around your airways tighten, making breathing difficult. Bronchodilation means the inhaler relaxes those muscles and opens the airways. Can you show me how to use the inhaler correctly? Of course. First, shake the inhaler well. Breathe out fully. Place the mouthpiece in your mouth. Press the inhaler once while taking a slow, deep breath. Then hold your breath for about 10 seconds before breathing out slowly. What if I use the inhaler several times a day because it makes me feel better? If you need the reliever inhaler very frequently, it may mean your asthma is not well controlled. You should contact your doctor rather than increasing the dose on your own. Are there things that can trigger my asthma? Yes. Common triggers include dust, smoke, pollution, strong odors, pet dander, pollen, and respiratory infections. Try to identify and avoid your personal triggers whenever possible. How will I know if I need urgent medical help? Seek immediate medical attention if you have severe breathlessness, difficulty speaking, bluish lips, or if the inhaler does not provide relief. Let me make sure I've understood. I should use the inhaler with the correct technique. Avoid asthma triggers, not overuse the inhaler, and seek help if I have severe breathing difficulty. Excellent, Rohit. You've understood perfectly. Do you have any other questions? No, doctor. Thank you for explaining everything clearly. You're welcome. We'll work together to keep your asthma under control.